Hi, everybody. You're probably going to be on mute. We do have a webinar, a new guest series here at eSIGHT. I'm here in Toronto, and we have Dr. Penny over here as well in Tucson, Arizona. She will be hosting today's coffee chat as our special guest. She's been doing a lot of things. I don't know how long she's been working on this new study where she's been surveying just under 2,000 people living with low vision and blindness. And right now she's going to help us out in understanding, different modes that she's been examining when it comes to healthcare, transportation, meals, employment, things like that. So without further ado, I'd like to welcome Dr. Rosenblum. Hello.
Hi, well, thank you so much for inviting me. Let me first just introduce myself, and then I'm going to be talking with you about a survey called Flatten Inaccessibility. And I'm suspecting that just about all of you are going to be able to identify with much of what I'm going to share with you from the research that we did. And don't think research that I'm going to talk to you about a lot of numbers and stuff. I'm actually going to tell you stories from some of our participants. But like many of you, I also have low vision. I was born with my visual impairment, congenital cataracts, and nystagmus due to rubella that my mother had. So probably a little bit different than many of you who I'm guessing have an acquired vision loss. I've been a teacher of visually impaired children for 35 years, but much of my time has actually been spent in the academic world. So I was a faculty member at Florida State University in the late 90s, and then the University of Arizona for 20 years. My grant that was supporting me at the University of Arizona ended on January 6th, which was really convenient because that was also my first day as the Director of Research at the American Foundation for the Blind. AFB, or the American Foundation for the Blind, is going to be celebrating its 100th birthday next year, so not a lot of organizations can say they're a centennial. I was explaining to our hosts here at eSIGHT that we're actually not a service organization, so we're not like CNIB in that we have clients that we're working with, and we're not a membership organization, for example, like the National Federation of the Blind or the American Council of the Blind in the US. Instead, we're an organization that focuses on creating a world of no limits for people with the visual impairments through research, through policy. We do have a consulting arm, so we work with a lot of companies to help them make their websites and products accessible. So I've been at American Foundation for the Blind just under 9 months, and I was getting ready to get rocking and rolling. Had gone to enough meetings in January and February for an Army. They kind of told me some of the research projects they had on tap and some of their ideas, and got my 2 monitors set up in my home office. I was ready to go, and then COVID hit. And like you, COVID changed our world considerably. So you may be familiar with a company called Aira. If you're not, check out Aira, A-I-R-A. It's a app that allows you to connect with somebody who is a trained agent that can help you visually interpret the environment. So what does that sign say? Is this, jar of something in my refrigerator expired? So Aira is a great tool, and if we haven't had Aira visit for an eSIGHT happy hour or coffee hour, sorry, happy hour, I'm a little ahead of myself, might be an idea. Troy Otillo, who's the president of Aira, contacted Dr. Kirk Adams, who's the president of American Foundation for the Blind, said, could you help us out with a little tiny survey? We're seeing here in March of 2020 with COVID that people are connecting with Aira for different reasons than they used to because of COVID and having to stay at home and changing very quickly to working at home. And so the little tiny study grew into a big study. And I'm really excited that next week we'll be posting officially our report, and we'll make sure that eSIGHT knows that it is out there. So if you don't have the time to get it directly, hopefully they'll share that with you. So what I'd like to do in our time together is I've put together a PowerPoint, which, because I think in PowerPoint, I will read everything on the PowerPoint, so not a problem if you're not visually accessing. It's more just to help me to stay focused and also to be able to tell you some of the stories. So we're going to talk about 4 areas today. healthcare, transportation, access to supplies like meals and shopping and those types of things, and employment. After each section, I'm going to stop for a couple minutes for questions and comments, and then I'll move on to the next section. So there'll be 4 opportunities for you to raise your hand and ask a question. And let's get those real quick rules on how do we raise our hand again?
Oh, great question. So what you'd want to do for everybody on this call, at the very bottom of your screen, on the far, I believe it's in the participant section, you tap on the little icon that says participants, and in there at the very bottom it says more. So you just click on that and you hit raise hand, and you're able to raise a hand. And I already have one hand raiser here. Congratulations, Kuros, who's raised his hand already, or her hand. We'll chat with you a little later on.
Okay, and if you're not a visual type of person, it's also Alt-Y. And I'll remind you of those 2 things when we get to the hand raising part. But I do want to give you an opportunity to share your comments or questions related to this study. I know there's lots of things related to visual impairment we could talk about, but for today's coffee hour, we're going to focus on the Flatten Inaccessibility study. And I have 3 pictures up here on the screen. I have a Black woman who is using a digital thermometer that's accessible to take her temperature, really important here in COVID. I have an older woman with her mask on, using her walker to get on what we call paratransit here in the US, but a van that is door-to-door service for people who are elderly and disabled. And I have a young man wearing his mask, using his smartphone with an app to read a price tag in a store. So I'm glad to know he has his mask on. So what information can I share with you that's valuable for those with low vision from this research study called Flatten Inaccessibility? So the idea for Flatten Inaccessibility, or really the question, I don't know why I say idea here, it might have been that it was 9 o'clock last night. How has the COVID-19 pandemic impacted the lives of adults with vision loss in the United States? There was a parallel study that CNIB ran out of for Canadians, and I don't have those results. So I'm going to focus on the US results, but I'm going to tell you, I know that they're very similar. We do have a website. I'll post it again at the end, and I'm going to ask one of my eSIGHT friends if they would also go ahead and type this website address for me in the chat. So it's afb.org/Flatten Inaccessibility, and that's all together, Flatten Inaccessibility. So would one of my eSIGHT friends please put that in the chat for everybody, and that way if you do want to bookmark, you can do that. Thank you so much, Mr. eSIGHT. I'm so bad with names. I'm just going to call them Mr. and Mrs. eSIGHT, so not to be rude to our hosts. Okay, so there were 20 organizations, I'm sorry, wrong survey. There were 16 organizations that collaborated, meaning that they gave ideas for questions potentially. They shared information about the study with the folks who they support. So I'm going to just read those off real quickly. American Council of the Blind, AER, AFB, IRA, American Printing House for the Blind, Be My Eyes, COSB, which is Council of Services and Schools for the Blind, Humanware, Johns Hopkins Medicine, National Federation of the Blind, NOAA, which is National Organization of Albinism and Hypopigmentation, Objective Ed, Prevent Blindness, Professional Development and Research Institute, Vision Serve Alliance, and Vispero. So we have a combination of companies, service organizations, those who advocate for individuals with visual impairments. So we don't have this happen in the field, that organizations and companies come together in a 3-week time to support this level of research. So this is pretty unprecedented. Okay, let's just briefly talk about the survey for what we call visual eye candy. I have a picture of a man in his 30s, a white man with his cane and his mask on, and in his arms he has his little toddler who's holding up her mask as well. I also have a picture of an Asian woman who is using her smartphone to do shopping. So this survey looked at demographics. Where do you live? How old are you? That kind of stuff. Technology, what tools do you use? Healthcare, transportation, employment, your education. And that was whether you were going to trade school, college, or were getting rehab services, for example, through CNIB if you were, well, we didn't have Canadians, but the equivalent of CNIB for Canadians. In the US, it might have been through a lighthouse or a rehab agency that was local to your community or the VA. Education of your K-12 child, social experiences, access to meal, foods and supply, and voting. So we gathered information from the participants. How many? Well, 1,921. And somebody pointed out to me yesterday, which I never picked up on. I told you, American Foundation for the Blind is celebrating our 100th year next year in 2021. So the number of participants is the year we were founded. Isn't that fun? Great fact. Anyway, our participants were between 18 and 75 years. They represented all the 50 states in the US. There's a lot of states down here. You guys have a lot fewer provinces, but we have lots of states, Washington, DC, and Puerto Rico. 59% were congenitally visually impaired. So that means before the age of 2, they got their visual impairment. So we're a little skewed in that sense because many people get their visual impairment later in life, whether that's retinitis pigmentosa or macular degeneration. We were high on the white side, 74%, 63% females, 42% over age 55, and 45% of the people had one or more disabilities. So that might have been diabetes, heart disease, a hearing impairment. So there were 1,921 people who answered the demographic section and the technology section. After that, they got to choose which sections of the survey they answered. So not everybody answered each survey section, but many people answered questions in healthcare. And one of the big issues that we wanted to know about were, did people who were low vision or blind have concerns about getting to a test site? And yes, they did. This was a concern for people who took the survey. And I forgot to mention, we collected these data. So the survey was open in the month of April. So if you think back to where your brain was in April when it came to COVID-19 and where your brain is in September when it comes to COVID-19, back in April, it was really new to all of us. In the US, all schools had stopped having kids come to school for the most part. There were a few pockets. Most companies had started to implement working at home for non-essential workers. So many communities were requesting that people stay at home. So we were really just getting into it. I don't know about you, but I went through a lot of Clorox wipes in April. So one concern we wanted to know was for people with visual impairment, can you get to a testing site? Do you have a concern about this? And one participant shared, I'm not sure how we get to a mobile test site. I wouldn't feel comfortable using public transportation or rideshare services for fear of backlash or spreading COVID-19, sorry. So in the US, most of our sites were drive-up sites initially, and most of them still are. So if you're a non-driver because of your visual impairment, how are you going to get there safely without endangering others was a big concern. Another concern that our participants had was access to medication. Now, many people are already using home delivery for medication, but many of our participants were not. So some of them needed to make that switch to having my medication sent to me. Well, they found out that apps weren't always accessible or websites, so they ran into technology challenges trying to set up that home delivery. Some medications require that you have to go to the pharmacy to get them. So one of our people shared, I take one medication that is a controlled substance for sleep. It has to be picked up from the pharmacy. I asked if there was any way it could be delivered since I'm totally blind. They said I could come to the drive-thru. I'm not sure what car they think I will drive. We really found that many of our participants were already struggling with being a non-driver or not being able to drive because of their visual impairment, and that COVID-19 really exacerbated that for them, that things that were already challenging at times became more challenging when it came to transportation and healthcare during COVID-19. Now, I know that this group, many of you use the eSIGHT device, and that's going to let you easily look at your prescription labels. But for some individuals who don't have a device like eSIGHT, they didn't know that they could ask the pharmacist for a large print or braille labels or script talk, which then lets you hear your prescription. So that was another issue that some of the participants raised. Hospitalization. This is a big issue already when you go to the hospital or the doctor's office and they have this whole stack of papers for you to sign, and those are not accessible to you because you have a visual impairment. Many people will take somebody with them when they go to a hospital or to a medical appointment that's going to be important, where they anticipate that there's going to be paperwork to fill out, or they're going to need access to information like how to find the specific office, or the department where they need to go to get the procedure. But due to COVID-19, people were not allowed to bring somebody with them to the hospital. And this really was anxiety causing for many of the participants because they were concerned about access to information. They were also concerned about not having somebody to advocate for them. So one participant shared, "It would be terrifying for me to be hospitalized alone, especially because I know people don't value my life because they think my quality of life is less than theirs. Without someone to assist me and advocate for me, I feel like I was fighting the virus and a system that doesn't want me." We heard from many participants about the fact that they perceived or believed or had experienced, and there was a range there, that as a whole, society, including the medical profession, did not value individuals with disabilities at the same level they valued people without disabilities. So there was a concern on the part of some of our participants that if medical professionals had to make a decision, we have 10 ventilators, we have 12 people who need ventilators, that those with disabilities would be the ones who would not get the ventilators strictly based on the fact that they had a disability. So this was a concern for some of the participants. We had other concerns as well, but I only get to visit with you for an hour. So at this point, I'd like to stop for a couple minutes, and I'd like to see if we have questions or comments, and we're going to keep those focused on healthcare related to COVID-19 questions. So now to ask a question, you go to participants, you go to more, and you go raised hand, or you can do Alt-Y on your keyboard. So I'm going to turn it over to eSIGHT to call on somebody for a question, please.
Thanks so much, Penny. And maybe if you have a Mac, it might be Command-Y. We'll keep it open to anybody who is available right now. I have a couple of questions though, Penny, if you don't mind. You mentioned about the curbside pickup. What do you do if, let's just say, that's all they offer? I mean, is there an alternative or anything that you know of when it comes to like a restaurant, if you want to drive up to the restaurant and pick something up? I mean, what have you seen?
Sure. Actually, in my next section on transportation, I'm going to mention that people talked about walking up to drive-thrus,
Okay.
and I actually bike up to drive-thrus. I pick up prescriptions and meals. But my first suggestion would really be to call that business to see if they deliver, or to consider using a delivery service like Uber Eats. So that would be a couple options for you.
Okay. In terms of healthcare, though, I'll open up the floor to a couple of folks. I see Jeanette is here. I will go ahead and unmute you, Jeanette. Jeanette, how are you?
Good, thank you. How are you all?
Oh, we're doing great. You have any questions today for Penny?
Well, I have a comment on that last quote, Penny. Thank you so much, by the way. This is an awesome presentation. I've referred a lot of people when I was working at the Lighthouse to AFB, by the way. So I'm an advocate for your organisation. Regarding this quote from somebody who feels like they're fighting the virus and they're not valued, I think in a hospital setting, I myself had an eye operation in May. So you can imagine that was right in the middle of it all. Okay, but it was just when the particular place where I went to was able to service certain surgeries. And I had to insist, I had to say, you know, I'm legally blind, I'm visually impaired, I need my assistance person with me. And, you know, they did acquiesce, only at the point of the surgery, then I had to be on my own, and that can be somewhat daunting. But, you know, I think if a person is encouraged to insist, and I think it's the same with many, many other factors when you have a disability, be it accommodations in work, be it whatever else, I think we have to learn to be assertive in a polite way, but nevertheless we have to be assertive.
Thank you. And absolutely. And I think COVID-19 or no COVID-19, you bring up a wonderful point about assertive but polite. And you know, I think when you can explain to somebody why, I will not be able to see the paperwork, I will not be able to locate the room I need to go to for the blood draw, whatever it's going to be, if you can explain to them, it's not just that I want my husband, my wife, my friend, you know, my neighbor to come with me, but there are specific parts of this activity that I will not be able to do, so therefore I need this assistance. You can help people start to understand. Thanks for sharing. Let's see if we have another comment or question, please.
Sure, we have Rosa as well. She's here. Rosa, do you have a comment or anything? I'll go ahead and click the unmute button. You might have to do the same on your end.
There we go. Good morning. How are you?
Fine, thank you.
We're still going through it here where I live currently, and one of the challenges I'm thinking is when you can't go to the doctors and they're pretty much pushing you towards online visits and Zoom meeting visits. A lot of VI people may not have access to a computer and or Zooming technology. Have you found caregivers or physicians open to phone consultations and things like that, or are they pretty much pushing to online Zoom meetings?
You know, one of the questions we asked about was around telehealth. Have you used telehealth?
Right.
Was telehealth accessible to you? And we found about 50% of the folks who had used telehealth, and it was a couple hundred people in the survey sample, reported some issues with telehealth. Throughout the report, we make recommendations, and one of the recommendations we make is around providers and telehealth, that providers may need to have a non-medical person who can work with the visually impaired person to get the telehealth set up so that when the doctor or nurse, quote unquote, comes on, you know, the camera's positioned properly. I think it really goes back to our comment from our last individual that as a patient of that, you know, care provider, explaining, I don't either have the technology or I can't get the technology to access. Can the doctor, you know, or nurse call me,
Right.
is important, but it is an issue. Absolutely.
Yes, for
Thank
sure.
you so much. I'm going to go
Thanks,
ahead
Rosa.
for the sake of time, Rosa, and my other friends. I'm going to move on to the next section. We'll come back after a couple more quotes I share, and you'll have an opportunity again for questions or comments. The young woman who is on my slide for the comments and questions, you can see her Clorox wipes right there on the counter, and she is wiping surfaces. Let's talk a little bit about transportation. In the US, we had several issues around transportation. One was because people were staying at home, many public transit companies, you know, bus companies, either canceled or reduced service. Yet people with visual impairments and other folks who don't have vehicles, you know, for whatever reason, still needed to get to the grocery store, to the, you know, the testing site, to the doctor, to the food bank, wherever it was that they needed to go. So that reduced schedule or that cancellation of public transit was really problematic. Now, many people chose not to use public transit during April, and many people still here in September are choosing not to use public transit. But when many locales in the US were allowing people to use public transit, they put a policy in place that instead of boarding at the front of the bus, you boarded at the rear of the bus. And this caused problems for some of our participants in the sample. One of the reasons was because At the front of the bus has accommodations for people with disabilities, so the bus kneels so you don't have to step up as high. The back of the bus, you don't have that option. So there's these big steps that you've got to get up. If you're using a walker, if you have arthritis, that's more problematic. And then you don't have access to the doctor. You don't have access, wrong section. You don't have access to the driver. In some locales, they put partitions up between the driver and the passenger, so you weren't able to ask questions. So one participant shared, we do have to enter and exit at the rear of the city bus, which can be difficult. They tell you not to touch the railing, but I have to hold the railing in order to try to gauge depth perception, since I use a dog rather than a cane. So there were participants in our study who felt that there needed to be a happy medium. They understood the drivers wanting to be safe. They understood, the need for, people to social distance. But at the same time, they're like, I need to access this bus to get where I need to go. And I need to be able to do so safely. And I need to have some communication with the driver from time to time. We also found that people were concerned about using human guide. So they're walking with somebody, whether that's in an indoor environment like a grocery store or an outdoor environment, walking with somebody to a bus stop, that engaging with a human guide was problematic, because somebody said people are practicing social distancing and some are unwilling to offer an elbow for sighted guide travel. The social safety net I rely on during normal times has been disrupted. It's humbling. So, not being able to go somewhere and just say, could you show me where room 27 is it okay if I hold your elbow, which we would normally do and asking for human guide. Now with social distancing, there's a challenge, because people aren't willing to let you get that close. You don't want to put somebody in danger, and it really impacted people's ability to move around in the community. Safety was a huge, huge concern when it came to any type of transportation, whether it was public buses, paratransit, so like the vans that will take people with disabilities or the elderly, whether it was rideshare like Uber or Lyft, or whether it was taxis. We heard over and over again about people's concerns around, are those vehicles clean? How do I know if they're clean? Whether it's a rideshare and it's just me and the driver, how do we maintain social distance? If I get on a bus, how do I know where the other people are? And where do I sit so I'm maintaining a social distance? Are other people wearing masks? I don't have the vision to be able to see that. So one of our participants shared, transportation has been one of my greatest fears during all of this. I don't want to risk all the germs in an Uber, not to mention there are less drivers. Things like buses and trains have been shut down. Also, I wouldn't want to be in such a small space with so many people. I don't feel safe doing anything but walking. I can get to a pharmacy and a few restaurants, but I can't get really anywhere else. This person was lucky in that they did have some things they could walk to. We heard from many participants that they had nowhere that they could walk to. So they were reliant on others to bring things to them, or in some cases to take them to things like a store or a restaurant. If there was somebody in their bubble, a family member, for example. But many people had not left their home since the pandemic had started, and they were feeling very isolated. And some people were feeling forgotten. People who didn't have a strong social network before the pandemic, their network shrinked even more during the pandemic. I have a picture here of a young woman with her mask on and her cane getting ready to board a city bus for my questions and comments slide. So Mr. eSIGHT, turning it back to you to get us some more question askers, please, or comment makers.
Sounds good. I mean, I'll be selfish and I'll go first. But I mean, when it comes to like ticketing, I know back in the olden days, you'd be able to go to a like an office or something and purchase a ticket that way. I know with the airline industry, it's pretty accessible when it comes to purchasing a ticket from United or Air Canada. But I think the bus world, you really don't have that online option for most places. I know with Megabus you would and all those big guys, but for this one over here, how does that typically work? I mean, is there ever an obstacle there when it comes to who do I buy this ticket off of now, and are the websites accessible?
I think again it varies from community to community. Some at least here in the U.S., some bus companies you can buy a pass like at the grocery store, or you can get a card and then keep adding money to it. The U.S. buses that I have been on, you still can pay with cash. Of course, you've got to locate the kiosk. That's something, or not the kiosk, the little machine at the front where you put in your cash or you swipe your card. And again, that's something else that you have to touch. Many of our participants talked about carrying wipes with them. So if they needed to touch something, they would do it with a wipe. One person talked about, I'd put my hand in a plastic, like I bring a bunch of grocery store plastic bags, and I'd put my hand inside of a grocery store bag to touch things. Thanks for the question.
Great. And we also have Myra. Myra, am I pronouncing that right?
Yes, you are.
Awesome. Do you have a question for Penny?
I actually have a statement. I was deeply hurt to feel that there are people out there that don't think that there are any advocates for the blind or anybody that wants to help. Please pass on that they can contact, if they have one, a local Lions Club or possibly their churches. They're looking for, like to drive people. They're looking for things to do to help people. But if they don't hear from you, they don't know that there's a need. Absolutely. So please contact your local Lions Clubs, which were invented to help the blind. And of course, a lot of the local churches, they help everyone. And they may think, oh my God, that's a great idea. We'll start a little bus service for people.
Absolutely. Thank you.
And I do have a question that's non-COVID related, if you don't mind my asking. Have you heard anything else on the CRISPR technology for the blind?
I'm not familiar with the CRISPR technology. Myra, can you tell us briefly what that is?
It's basically down at the DNA level. They're actually trying to fix eyesight. Obviously, right now it's all, they've got kids in, I think, South America that have been cured of diabetes.
Wow.
But of course, it's all experimental. And they don't know, they're still waiting to find out whether it's going to hold or not. Right now, but it's very, if it's genetic, there's a possibility that it will be able to be fixed within 5 to 10 years.
Great. Well, thanks for
and they just had a surgery.
Okay.
Please look it up online.
I will make some time to do that, and hopefully maybe eSIGHT can consider inviting somebody to talk about medical advances. So great question and comment. We'll go ahead. We're going to on the hour, so let's go ahead and move on to the next section.
Thanks.
So we're going to go ahead and talk about access to goods. So we talked about meals in this section, supplies, and food. So one of our first issues that people talked about over and over again was, okay, I've got an app to do Instacart or my local grocery store or Walmart, but I can't get a delivery slot. Or it's so time consuming because this app isn't fully accessible for me to find a delivery slot. So a person shared, I mainly have been using Peapod because I can get much lower prices than in the major city stores. I do not know if I have missed an occasional available delivery time slot. There is no way to find out quickly, but I've looked through 3 weeks of days and not found anything. In the initial first couple months of the pandemic, there were many people, both sighted and visually impaired, who were having groceries and other supplies delivered that had not done that before. And so the number of people making those delivery requests really went up. At the same time, many delivery drivers were like, I don't want to take the risk. And so we really saw that there was people who really truly were waiting weeks to have things delivered, or somebody for Instacart, for example, went to the store to get their order, and there was no toilet paper, there were no wipes, there was no soup. And things have stabilized, I think, for many locales in the country and the US, but we were not as a country prepared for this onslaught. At the same time, some of these apps and websites were not fully accessible. And so that added another layer for people. And then we also had people who talked about, you know, I can do a basic email, you know, I can FaceTime with my grandchildren, but I've never ordered groceries online. So now I need to learn how to do this, but nobody can come over to help me learn how to do this because we're all self-isolating. So I'm in this, you know, catch-22 of the people that would normally help me learn how to do something I can't access because we're social isolating. Some people were continuing to go to the store, and that was presenting some issues. Some issues were that people, the way they would typically go shopping is they would get to the store, they would go to the customer service counter, and they would say, you know, I'm visually impaired. May I have a store employee assist me in locating different items for my grocery shopping? And in the United States, that's a very common practice, and that would be happening. But during COVID-19, A, due to social distancing, and B, due to you know, not having as much staff, a lot of stores were saying, oh, we don't do that anymore. Well, where does this leave this person with a visual impairment who needs to do their shopping and get their supplies and get their food? So one person shared, my greatest concern nowadays is having to most likely use assistance in the store. I'm low vision and I'm concerned about bringing items too close to my face to read them. Going forward, I will seek assistance and always travel with my white cane. And I think that this last sentence, I will seek assistance and always travel with my white cane, is an important one. I know for myself as a person with low vision, and I know for many individuals with low vision that I've talked to, that, you know, do I use a cane? Do I not use a cane? Some people psychologically are like, that's me admitting, wow, my vision's really gotten bad. Some people, there's a stigma. People aren't nice to people with disabilities, might be their thinking. So they hesitate on learning to use a white cane, or they've, you know, taken some orientation mobility instruction, but they put that white cane at the bottom of the closet and they don't use it. Several of our participants talked about how they were now going to start using their cane as a symbol to let people know, hey, I'm getting closer to you because I don't see well. Or I'm not staying on those little marks they put on the floor in the grocery store to keep people 6 feet apart because I don't see well. And so for some people, COVID-19 actually caused them to reconsider using that white cane as a way to self-identify, so that if their actions weren't appropriate, quote unquote, they weren't staying 6 feet apart, people would understand. Or if they went to the service counter to ask for assistance, they were more likely to get it because they had a disability. So something to think about for your own self if you're kind of one on those fence white cane folks. Radio had a question about the drive-through, but we heard about drive-through and curbside pickup over and over again. One of our people said, lots of businesses are drive-through only, which excludes me. I admit, I've walked through a drive-through because I had no other choice, but even walk-up windows are closed. I do not want to ask friends to help me as they are worried about their own health and safety. And this was an issue. Long lines for, let's say, food bank pickups or pharmacy. How do I, as a person who doesn't drive because of a visual impairment, how do I access those types of services? I don't want to ask somebody to take me. I don't want to hire a ride share because I don't want to put myself at risk or that other person that I'll be in this closed vehicle with at risk. So this was very daunting for some people, and there was not an easy solution, especially for folks who were on a fixed income, had limited financial resources. Their options were very limited, and many people were going without. One of our participants, and I'll paraphrase it, I don't have that quote in front of me, but basically said, well, I had a lot of stuff in my pantry when this started, but I don't know what I'm going to do in a few weeks when there's nothing left in there. And that was heartbreaking for our team to read comments like that where people really didn't believe and maybe very truly did not have options to get the basics in life. People talked about how sighted folks could get in their car and they could go to 3, 4, 5 stores to look for toilet paper. But as a visually impaired person, I can't do that. So I'm disadvantaged. One person suggested that like stores have senior hours. Here in the US, that was primarily early in the morning, where several seniors we heard from is, I can't be standing in line to wait for a store to open at 7 a.m. So sometimes that wasn't working because of the senior issue. But that stores should have, options for people with disabilities, should give them special hours. All right, so we have our question and comment. We have a lady here who's African-American, who's doing her grocery shopping. She's got her mask on and she's putting things in her cart. She's also wearing gloves. So we'll stop for a couple comments or questions, please.
Sounds good. I have Sheila here. Sheila, are you with us? Sheila? Penny, you wouldn't have to know the hotkey for unmuting. I think it's the space bar, right?
It's Alt. If you didn't ask me that, I would be able to tell you.
I think if you hold down the space bar, you can go ahead and unmute yourself. But let's move over to Ray. Sheila, I'll wait for you whenever you're ready. But Ray, if you'd like to unmute yourself, feel free to do that. You can ask Penny a question. Go ahead.
Sure. Thank you, Penny. Great survey. I was one of the participants in it, and really was great. Just a couple of comments that things that during the pandemic, my wife and I are both visually impaired, and we actually did find the senior hours to be very helpful. Yes, it was early in the morning, but a number of stores, even now, what they've started to do is, even if there's a line, they're trying to keep, the capacity down, they'll let us go ahead. And we were fortunate, didn't have too much trouble getting assistance. Had a couple of hesitations, but that was, for the most part, that worked out good. But the other thing that I didn't think about until talking with people kind of a ways into the pandemic is, you think about having to take someone's elbow. Well, where were they telling everybody to sneeze? Into their elbow. And so that was kind of like, okay, so it's like, okay, do we have to carry hand sanitizer or something with us all the time? And then the last quick thing I would share is that I actually had a rideshare driver. I still used rideshare during the height of the pandemic. And I actually had a rideshare driver basically say, I can't take you unless you promise you will not cough in my car. How are you supposed to do that? and it made sense why he said that, because he had elderly parents he was caring for. But it's like, okay, that's kind of, how do you know when you're going to cough? So just a couple of anecdotes I'd share with you.
Well, thanks for sharing those, Ray. And also thank you for being one of our 1,921 participants. And I hadn't thought about the sneeze into your elbow. We, use Human Guide. So good point. And absolutely, I think everybody should be carrying hand sanitizer. So make sure you put some in your pocket, right?
You got it. Yep.
All right. Let's see if we got our friend that was having trouble getting unmuted.
Sheila, are you with us? Well, if you want to ask the question in the chat, feel free to open up the chat window and type out your question. But Penny, if you'd like to proceed, feel free to get this ball rolling.
Great. Well, we're going to go on to our last section, and then that should leave us a few minutes at the end for some more conversation. And that was employment. Now, about 25% of our folks were retired, and about 30% of the people were not working pre-pandemic. So our employment group was one of our smaller groups, but I think it's a really important group. And what we found that there were people who either were laid off or furloughed due to the pandemic. Not a lot, but enough to be concerning. But then we did have about 300 people who were working from home. Don't swear me to that number. I'm floating in numbers. But we found that there were a couple issues, and one of those were that some people who had a setup at work, whether that was a setup because they were more of a screen reader, braille user, or a setup because they were low vision, that their employer wouldn't let them bring home that setup. So for example, one person said, I was not able to bring my large screen monitor home and not able to use my employer's Zoom text license from home. I had to purchase both. So this individual probably invested, I'm guessing, probably at least $800 to get set up to continue to do that same job at home because that employer wouldn't let them bring home the tools. Some of our participants didn't have that luxury of having the finances to get the tools that they needed to do their work from home. So some individuals, now remember this was April, so things had just shifted, but some individuals had made requests of their employer, and like this individual were not permitted to get the accommodation they requested. Some individuals had made the request and it was still pending, so they didn't know whether they would be able to make the changes. And some individuals were told, oh yes, you want to bring home your Braille note taker and your laptop that has JAWS, we'll either arrange for you to go back and get it, or yes, you can take it on your last day that we're physically on the work site. So we really found that it ranged for people whether or not their employer allowed them to bring home those accommodations. Over and over again, whether we were talking about access to meals and food and supplies, or we were talking about access to college or your child's K-12 education, or in this case, your workplace responsibilities, we heard loud and clear something that was pre-pandemic. It's a systemic issue for us with visual impairments, which is accessibility of tools. One person said, I use Microsoft Teams, Skype for Business, and WebEx for meetings throughout the day. They all have accessibility problems that range from irritating to serious barriers. In addition, I struggle to hear audio from both my screen reader and my colleagues on the video conference. People already were having accessibility with tools in the workplace, okay? As we were getting ready to start this meeting, the eSIGHT folks were like, oh, we'll do this on the Slack channel, if there's a problem with the speaker, hey, you Slack me, I'll Slack you. Slack is a really common tool. We use that here at AFB, so all day long, I'm sending little instant messages to people, and I probably have 5 of them sitting down here waiting for me when I'm off. We ding each other all day. I call it the dinger, because it makes a little beep sound. If that tool is not accessible, okay, yeah, I could, do my regular text, or I could call my colleague, but that's taking time. It's not being part of the norm for my workplace, culture, and that's going to impact my productivity. So I was already having those types of issues before the pandemic, but now that we're all at home and we're using these tools even more, those annoying type of things have now really become paramount and are starting to affect my productivity at work, my ability to participate. So that's an issue. Tools like Zoom are not fully accessible. Now, they're not bad if you're a participant and you want to raise your hand and you want to mute and unmute your audio. By the way, it's Alt-A. It just came to me, A for audio. And it's *6 on your phone. But if I want to be a presenter and I want to use what's called the polling tool to give you like an ABC choice, that's not accessible if I'm a screen reader user. The chat window, you actually can enlarge the text on the chat. I've been using Zoom for at least 2.5 years before I found that out. So there are challenges with these tools that have really come up even more so because of COVID-19. Productivity, I mentioned this a little bit already, but one person said, everything takes longer, is harder to do on my tablet and my slow Wi-Fi. My eyes wear out much faster. And I think the amount of screen time, both people who are visually impaired and sighted people are putting in, is impacting everybody's vision. I know for my own self, like ibuprofen, which already was a pretty good friend of mine, has really become a really good friend of mine because of the amount of virtual time I'm spending. For work-related tasks, for shopping-related tasks, for news reading-related tasks, that we really are spending so much time on our screens. And if you have low vision, that visual fatigue just really can be very draining. And so we heard that from some of the participants. So in this picture, I have a woman who has both a hearing and a visual impairment. She's using blue background with white text, both on her computer and on her captioned phone. Her keyboard has large yellow buttons with black letters and numbers for high contrast. And this is my picture for my questions or comments slide. So we can chat about employment, or we can chat about the transportation, the healthcare, or the access to goods and supplies part of Flatten. But let's try to keep our questions to this Flatten survey. So I'll open it up, please.
All right. Any questions? Feel free to raise your hand in the window. I believe it's Command or Alt-Y. Would you mind if I ask you a question, Penny?
Sure.
Awesome. So when it comes to the people who've taken the survey, and as you know, everything's changing all the time. How can we apply the data that you received from from April to now? How can you apply that data to where we are now? Because we're constantly changing with phase 1s and phase 2s. I mean, what can we take away from that?
Absolutely, that's a great question. Thanks for asking it. Yes, things have changed since April, and things are going to change in October and November and December. But some of the issues, such as we were just talking about with the technology not being accessible, with how to make sure telehealth is accessible going forward in the future, with thinking about transportation and the need to make sure that that back door is also accessible, are important. I think one of the biggest takeaways from this study that I think is important for all of us, and early on one of our listeners today commented about that need to be a self-advocate. Whatever the issue is you're having, whether it's curbside pickup or your telehealth app isn't accessible for you, you can whine and complain, to your buddies, to your friends, to your neighbors. But unless you let those companies know, those policymakers know, and not just once, but you go back and check, and you also offer solutions, that things aren't going to change. We are going to get through this pandemic, but I mean, in the U.S. right now, we have Hurricane Sally, lots of flooding and wind damage and stuff on our Gulf Coast. We have terrible, terrible fires in the West. We are going to continue to have both natural and man-made challenges. We are not, as a society, well prepared to deal with these challenges. And one of the last groups people think about are people with disabilities. So how can we, as a group of individuals with visual impairments, work together to ensure that there are plans in place? Nobody thought about, some people won't be able to go to drive-up test sites, until people started to say, hey, I can't get to a drive-up test site, whether it's because I don't have a car for finances or environmental reasons or a disability reason. I don't have a car. You have to give me an alternative. We have to come together and have one voice. And I think the data from this survey, and also our access and engagement survey that looks at the experiences of families of children with visual impairments and the professionals who serve them. We had 1,622 responses from that in the US and Canada. We put those data together and we advocate. That's really what we need to do. Thanks.
Awesome. We do have a question here. George, are you with us?
Yes, I am.
Hey, George. Yeah, we can hear you. Do you have a question for Penny?
I do. I'm a longtime user of the American Federation for the Blind. I call the 800 number every morning. But I guess I don't know what else you do, and you probably commented on that already.
Sure. I'm suspecting you might be calling the National Federation of the Blind, George. What do you call for in the morning?
It's National Federation of the Blind, yeah.
Yeah. Okay, so we're two different organizations, okay?
Okay.
National Federation of the Blind is a consumer organization. So yourself as a visually impaired person, you might be calling Newsline in the morning to get your news.
Yes.
And you have your convention every year. American Foundation for the Blind, we don't have any consumers that we work directly with, and we don't provide services, so we're not teaching people orientation and mobility. We're an advocacy and a research group that works to bring information to people and bring people together to advance and create a world of no limits for people with visual impairments. So we have our research area, our public policy area, we have a blog, so we have a great communication team. So, you know, we have a social media presence, like where we're sharing information. Right now, we just started a blog series called "What Am I Reading?" about, you know, things we're reading about. For example, accessible voting for people with visual impairments was one of the topics last week. We also do have a consulting part of American Foundation for the Blind. So if you're a company and you're not sure if your website's accessible for people with visual impairment because you've gotten all these phone calls from people who said, hey, I can't order my groceries online, you can hire AFB, American Foundation for the Blind, and we'll evaluate your website and then help you design it so it is accessible for people with visual impairments. So those are some of the things that we do, but we don't work directly with people with visual impairments.
I see.
We're an advocacy group.
I have a comment then on what really works well and has been huge for me. I've been legally blind for 10 or so years. Is the combination of the iPhone with the Microsoft app Seeing AI.
Yes, great app.
Is powerful because it's cheaper than buying a reading machine, and it's portable.
Yes.
And it's a magnifier. And the tools today are absolutely fantastic, but they take a lot of personal energy and the right technical help.
Yes. Thank you so much,
area.
George. Thanks so much for sharing, George. I'm going to go ahead and wrap up here real quick. Just I know we're about 2 minutes out from the end, but thank you, George. A final thought. This is one of my favorite quotes from the study, and the thought I really want to leave you with. We keep thinking we can outwit this thing and that things will go back to normal. Let's overwrite normal and use this opportunity to make it better for us. Lemons to lemonade. If I don't leave you with any other thoughts today, I hope it's that you can make a difference. Your voice needs to be heard, and if that's through your consumer organizations such as the National Federation of the Blind or the Blinded Veterans Association, the equivalent with CNIB in Canada, if that's you emailing or calling and talking to manufacturers or your local store, if that's calling your local newspaper and say, hey, would you consider interviewing me for a story so I can explain how I'm doing things during COVID or the challenges I'm having during COVID? We have to work together to address some of these issues. Now, our report called Flatten Inaccessibility, I have a picture of the cover here, will be out next week. I'm saying that with confidence because I've been saying that for like 2 weeks, but they're really telling me next week. There's a lot to do to this report. It's full of information. It has a lot of quotes from participants like the ones I shared with you today. It has a lot of recommendations. So how can we make a difference in the lives of people with visual impairment during COVID and beyond? So you can go to afb.org/Flatten Inaccessibility, all one word. And that report will be up by next Friday. If you are like, well, I won't remember, go there now. There's a link you can click on so that you'll get announced when the report is available. So again, afb.org/Flatten Inaccessibility. I want to thank eSIGHT for inviting me to be with you today for coffee hour. This was a lot of fun. I hope that some of the information I shared with you today will help you reflect and think about your own life as a visually impaired person. And hopefully you identified with some of the experiences of the participants so that you know that you're not the only one having some of these experiences. So thank you so much for the invitation to my folks in Canada.
Thank you, Penny, for joining us today. And I want to thank everyone for joining us to hear more about how we're making the community better. I think it's super important that we pay attention to it and also work hard to make it better for everyone. And yeah, and if you want to reach out to anybody here from eSIGHT, you can contact me, Yuval at eSIGHTeyewear.com. That's YOUVAL at eSIGHTeyewear.com. Thanks, everybody. Have yourselves a great rest of your day.
Thank you so much.
Okay, bye-bye.